January mein I started entire GI surgery from Sabiston, even though it was a new textbook, but I could finish it in 1 month. The few questions in general surgery will be in such a way that you can eliminate two options, but the remaining
Hmm.
two options are confusing for you. That is where your logic comes in, your understanding of basics come in. You have to read at the end of the day at least 1 hour a day, not every day. At least dedicate yourself in the first year only to general surgery part and the specialty part. It's going to make a huge difference when you come out. I
Hmm.
knew that I need something in a concise form, something which I can go through in a matter of hours. So that is where Marrow comes in for me. Sure. First thing I would do is I'll see all the videos of general surgery yours, make a note of
Okay.
it. If notes is
Right.
not made, or as you're saying, if a ready available notes is there, very much enough. The second part I'm gonna do is take the tables from Bailey and Sabiston, add it to your notes.
Hello, everyone. I'm Dr. Rohan Khandelwal, your Marrow SS General Surgery faculty. And I have the honor of interviewing Dr. Akhil Chowdari today. Dr. Akhil has secured a score of 261 in the recently conducted NEET SS exam, and he is going to be taking up a seat in CTVS. Also, in the INISS exam, he had a rank of 13 in the CTVS super-speciality at AIMS. So, heartiest congratulations, Dr. Akhil.
Thank you,
Best
sir.
wishes from the entire Marrow team. Congratulations.
Thank you, sir. Thanks a lot.
So, Dr. Akhil, why don't you tell us something about yourself? Where did you do your MBBS, your MS from, and briefly about why CTVS surgery?
Sir, I personally did my MBBS from KMC Mangalore, Manipal University. I was a batch of 2011. Then I pursued a career in general surgery from Ramaya Medical College, Bangalore, in the year
Okay.
2018. So I passed out in August.
So this was
So
your first attempt. I mean, the first attempt to
first
get such
attempt.
a great rank. Great,
Yes, sir. I
great.
finished in August. I prepared, honestly speaking, I prepared for September mid till the exam dates
Right.
properly. So the cardiac surgery, as such, there are two groups of people to say for cardiac surgeons. One who are born to be a cardiac surgeons who want to be a cardiac surgeon by birth. Other who develop interest in cardiac surgery during your general surgery part. So I'm come into the second category, which is minority actually, because cardiac surgery is taken by heart, not by brain, as people say. But it's
Right.
going to be both for me, both my mind and brain, heart, actually.
Yeah.
So it's
That's
a
that.
branch of pure passion, pure hard work, and pure skill. Not everyone has the opportunity to stop a heart and restart it. So
Absolutely. Absolutely. It's a magical
that's
feeling. No, I've experienced that in my CTVS rotations, and it's truly a
yes, sir.
magical feeling.
Yes, sir.
Great.
You will always, I would say that when you attend a cardiac surgery postings, if you feel the butterflies in the stomach, looking at the heart, looking at everything, if you get goosebumps, think that it is going to be very well satisfying batch for you. So I had
Great.
this feeling when I first saw the procedure in my rotations in second year.
Great. So, Dr. Akhil, coming to your preparation for the SS exams, so there are two aspects. There's the general surgery aspect and the CTVS component. Let's first
Yes,
talk
sir.
about the general surgery aspect because now that the pattern has been revised, general surgery has suddenly become much more important. So, please
Yes,
tell
sir.
me, how did you go about preparing for the general surgery part for both INISS and for NEET SS?
Sir, the first thing I did was I spoke to my seniors who got flying ranks in the previous years. What
Right.
is their general surgery part of preparation? How did
Mhm.
they manage? So everyone gave me the thing is that general surgery part A from Bailey, thorough in and out, then Sabiston tables, and from Schwartz endocrine part. And certain
Right.
people told add HPP part also from Schwartz.
Hmm.
So I basically during my MS preparation in final year, I understood that reading from these textbooks is going to indirectly help me in the entrance exam.
Hmm.
So even though it was pretty late, in January when Sabiston 21st edition, new edition was launched, I took it and I went through entire GI part through it, and I have written my exam from that only. So I was lucky enough to get my exams postponed. So I already read GI part from there, and I have read Bailey General Surgery. So I
Hmm.
knew that I need something in a concise form, something which I can go through in a matter of hours. So that is where Marrow comes in for me.
Hmm.
So the concepts which were written, the way things were asked to be remembered, it is not just go and mug up. It is
Hmm.
understand the concept, answer it based on your concept. So if you don't understand the concept, you are not going to understand any of the second part. So in the exam, you'll end up the few questions in general surgery will be in such a way that you can eliminate two options, but the remaining
Hmm.
two options are confusing for you. That is where your logic comes in, your understanding of basics come in. If you know that, you're gonna directly go and hit the answer.
So
So,
you saw the Marrow General Surgery videos. You saw the my Marrow General Surgery videos. I have a couple of questions. So students often ask me, as a postgraduate, how much time will it take me to finish all the general surgery videos? So how much time did it approximately take you to finish the videos?
sir, I used to split my day. I used to
Hmm.
split my day actually. First half of the day for cardiac surgery videos, which I
Hmm.
used to learn from other centers, and the second half of the day general surgery from Marrow.
Right.
So the speed I used to adjust, sir. If the topic I was comfortable with the topic, I used to go with 1.5 to 2x. If I was
Hmm.
not comfortable with the topic, so I used to keep it at 1x. But the part where it troubles is you have to make the notes because the notes is
Right.
not available yet. I was fortunate enough to have your already notes from my NEET PG time. So
Right.
all I had to do was just add in the
Just
pages
add
to
on
it.
to it.
Yeah,
Right.
I just added the pages to it and just started making notes. So the time got saved for me. But if you're making notes with 1x speed, so I had certain topics like plastic surgery, skin tumors, and GI, where certain topics I didn't have the notes. So I had to sit and make the notes. Those days I had to give extra time to general surgery. Honestly speaking, I finished all the general surgery part, entire videos by I started September mid around 10th, 11th. By October 30th, I finished everything of the general surgery parts. Totally. All the
Great.
videos. And before announcement of change in pattern, like two times the pattern was changed for me for my preparation. First, it was 150
Right.
common. Within 1.5 months, it was turned into back to 40-60 part. So I started giving grant test, even though I was underprepared. So the advantage in Marrow grant test was the topics which are not you feel are not covered are given there.
Hmm.
So that's the add-on part which people miss it. People think that grant test I'll give in the end, but that doesn't help you because when you give parallelly, so you know that you have already finished the topic. Suppose you have read breast last week, and in the grand test you are unable to attempt breast questions. That means your preparation you would have understood how much
Planning is
you read it, how much you understood it.
not.
So that's how it should be. But the content of what general surgery part was given in Marrow, I could say that I easily sailed through an INSS and both NEET SS. It was I felt there was nothing much extra topics to be added to it. The content was totally apt.
Right. So, few very important things which Dr. Akhil has said. Number one, what he said is that the videos for general surgery are completely doable in a month's time or maximum a month and a half, even if you devote 4 to 5 hours or 3 to 4 hours on a daily basis. That's number one. Number two, what he did was what he mentioned, he already had my previous notes, so that helped him. Now Marrow is coming up with the notes as well, and very soon NEET SS notes will also be available to all the users. And the third thing, which I feel is very important, what he mentioned was that the general surgery part, which was asked in INSS and and in the NEET SS exam, was quite similar to NEET PG, and that is what I feel as well. That almost 80% of the questions can be attempted by a NEET PG aspirant as well. For the rest 20, it falls back on your knowledge of MS and the additional points which are covered in the GTs and the Q bank. So, what he also mentioned was that the GTs are also something which one should do because the fringe topics we've covered up there. So, anything else which you would like to add, Dr. Akhil?
Uh, Sir, since so The aspirants for the next batch. So the thing is that you have two exams with two different combinations. INISS is different. NEET SS is different. So for
Right.
INISS, you need to know about your subspecialty in and out. For your NEET
Mm.
SS, it is going to be at a PG exit level. So you have to
Right.
dedicate time on if you want to go attempt INISS, so your preparation will change. If you want to attempt for NEET SS, your preparation is going to be different. If you try to club both, so you have to manage time according to for your subspecialty and general surgery part. Since NEET SS is going to be 150 questions, all general surgery PG exit left.
Right.
So dedicating time and knowing which topic is important is not important because this is the first time it's going to conduct. So it's everyone will be clueless. Everyone. So we don't know from where they're going to concentrate. Because this time when I gave NEET SS, this NEET SS which I given in Jan, I had one question from breast. Just one question from the breast. So I was pretty much shocked. Okay, what are they asking? Why breast only one question? But
Yeah,
thing is
this
that,
time actually the pattern was very strange that every subspecialty got a different general surgery paper.
yes, sir.
But what I feel, and I've even highlighted that in the recall video, is that they've leaked out a huge question bank for students.
Sure.
And
Yes, sir. That is
to
the advantage.
correct,
I
that
was
is the
about to say
advantage.
that because instead of 40 questions, you are ending up with 100 questions already ready made out of 150, which is going to come next year for the next
Right,
session.
absolutely, absolutely. So I feel that these topics and these questions students should really revise. And in the Marrow SS channel, we've already posted the general surgery recall. So you should go
Yes,
through
sir.
those questions and make a list of those important topics because there is a high probability that those topics might be repeated.
Sure.
So
Absolutely, sir.
yeah. So, Dr. Akhil, you already mentioned about the Bailey tables, the Sebastian tables, along with the videos.
Yes, sir.
What other tips would you like to share with postgraduates who are in first, second, third year who aspire to do MCH later on? How should they go about reading their books? Are there any tips which you would like to share?
Sir, the academic, what the general surgery PGs who almost 70 to 80% do is slog in the end.
Hmm.
Slog. Take your books. Once you're free from your clinics, once you get the study orders, you slog in the end for 1 month so that you clear the exams. What happens for that is you're gonna struggle in your super specialty entrance there. So if you start early, you don't need to sit and read every day. You have your phones, you have your ready-made PDFs available in it. You get a case of breast. You see different stages of breast cancer arriving to your OPD every day. Thing is that if you observe that and compare with the treatment protocols given in the textbooks, you're gonna remember it well. So to do that, you have to read at the end of the day at least 1 hour a day, not every day. At least dedicate yourself in the first year only to general surgery part and the specialty part. It's gonna make a huge difference when you come out. As I was telling to sir, like a good MBBS is a good MS, a good MS is a good MCH. So if you aren't a good MS, you won't justify yourself in MCH. You always think that I can do it well in MCH. MS is just an entry to MCH for me. Yeah, that entry is a huge entry. Huge
Right.
MCH, no one is ready in front of you. Come, please take it. There's an immense competition for it. People like you, like each branch has like 2,000 to 2,500 people competing for couple of hundred seats. So you
Hmm.
start early, you're gonna be comfortable in the end. The Sebastian 21st edition was released in January for me for my master's exam. Even though I read Sebastian 20th edition, since I read 20th edition of Sebastian, it was easy for me to go
Easier.
through 21st edition very fast because I knew where the updates were. As I was reading, I
Hmm.
knew the updates were changing, changing, changing. If you see UGI bleed, Sebastian 20th edition, the nuclear scan which detects was 0.1 ml. Now you go there, you see 21st edition, the values are changed. I don't
Hmm.
remember, but the values changed for sure. So you know
Right.
where the topics are changing and the flowcharts are changing. So it's going to be easier if you see. I was lucky enough, like January, may I started entire GI surgery from Sebastian, even though it was a new textbook, but I could finish it in 1 month because I have already read
Right.
the 20th edition during my PG time.
Yeah,
So
so I mean, slow, steady progress is what you're recommending rather than leaving everything towards the end. and better utilization of resources, like you're saying, even when you're in your postings or your clinics, just to have things
Yes, sir.
handy. And that's where I guess Marrow also comes in. You can always watch the videos as a ready reckoner, and that would
Yes, sir.
help. Also, Dr.
Yes, sir.
Akhil, what about the CTVS portion? Those who aspire to become, who aspire to do MCH and CTVS, what books or resources did you use for CTVS? Can you mention
Sir,
the books?
CTVS, sir, Sabiston and Spencer Surgery of the Chest was a book. And
Hmm,
during my NEET PG times, I had the cardiology physiology part, anatomy part, and the embryology part already written for me. So the basic
hmm,
sense of cardiac is needed. Along with that, it is divided into parts. So what I have observed in INISS and NEET SS is, if you take 100 questions, 90 to 95 questions are from cardiac part, 2 to 3
hmm,
from thorax, and 2 to 3 from vascular.
hmm,
So thorax part is pretty much limited. You should know what to read and what to leave. So you have to make a list of the topics. So I made a list of topics for thorax: lung cancer, thymoma, mediastinal tumors, and pleural effusion. This is how I read. So TB was well a part of it, and along with that, during NEET PG time, whatever the thorax was part was there. That is well sufficient enough. You
hmm,
need to know about rib tumors. You need to know about pneumothorax, hemothorax, which is already covered in trauma for you. So you
hmm.
interlink them. So that's where you know. So the only extra part which you have to cover in thorax is chest wall
Cardiac.
deformities. Chest wall deformities, where for thorax, vascular is very much covered in general surgery. I don't think anything extra is needed from that because
Hmm,
every question which is going to come from there only. They're not going to
hmm,
ask you high wave questions. Image, you take capillary hemangioma, it is available in Bailey, it is available in Sabiston. So images are there in front of you. Just compare them then. But the cardiac part, if you are preparing, so if you know well in advance that you're going to prepare for cardiac surgery, then it is advisable to start in second year to read the major textbooks like Saviston and Spencer. 21st, it's not 21st edition. It's a cardiac surgery textbook. It's a surgery of the chest. So I
hmm.
just went through it during my second year, and I made points out of it. Basic, simple points. Tetralogy of Fallot. What is there? What is going to be the part of, what is the name of the surgery, how is it going to do it, what is right ventricle isolation, what is everything. So I understood those topics, and I already spoke to cardiac surgery pass outs who have
Hmm.
cleared. So I asked them, what are the topics you're going to concentrate. So they're told, divided into congenital disease, divided into acute coronary syndrome, then divided it into trauma and pericardial disease and heart tumors. So they were into divided into sub 4 5 branches.
So
So I
methodical approach, like you said, right from congenital anatomy, physiology, if you
Yes,
divide
sir.
it, and majority of it, like you said, is covered in the general surgery, except for the cardiac part, for which you need to
Yes,
read
sir.
Subiston and Spencer's, the textbook which you've recommended.
Surgery of the chest. Yes, sir.
Surgery,
Because that is
surgery.
where you're going to understand it. That is where you're going to understand it. Because they're not going to ask in details, sir. They'll just ask you. Personally speaking, during my NEET SS, they drew a diagram of the heart and they mentioned a procedure. What is it? So I had to
Mhm.
tilt my head and observe it. It was very awkward position. But I knew what was the procedure because the same image is drawn from the Sabiston textbook. They just drew it.
Right.
INISS asked you, right, coronary artery dominance is based on what? INISS level question this was. That means you should know your basics pretty well. They are simple question. Coronary artery dominance is because of what? Is a posterior descending artery coming from either right or left? So this was a level of questions. You will think that okay, they're gonna ask me mechanism of TOF, they're gonna ask me mechanism of TGA. No, they'll ask you simple, straightforward questions. Keep your basics strong, you're gonna answer well.
Right. So one last thing, Akhil, which I want to ask you is that supposing you were to appear for the June NEET SS exam again, where
Yes,
there are
sir.
just 150 questions, what would be your approach for general surgery? So now those who are starting to prepare now or unfortunately haven't got a rank in this time's NEET, how would you
Yes, sir.
approach general surgery for the June exam?
Sir, first thing I would do is I'll see all the videos of general surgery yours, make a note of
Okay.
it. If notes is
Right.
not made, or as you're saying, if a ready available notes is there, very much enough. The second part I'm gonna do is take the tables from Bailey and Sabiston, add it to your notes. If the notes is available in PDF, you can just add it to your iPad or Mac notes, whatever it is. So these
Mhm.
tables are gonna make a difference. For example, if you compare certain questions like they're gonna ask you which which procedure will give you highest rewarming rate. It is a cardiopulmonary bypass is going to give you highest rewarming rate. It is a table. It is given in the end of the table in Bailey. If you see adrenaline part, adrenal insufficiency, patient is undergoing orthopedic trauma. What is the dose of hydrocortisone? It is given clearly in the table. For this surgery, this is it. So these are the questions. These are ready-made questions in front of you. So the tables is where you have to concentrate. Yeah, there are certain factual questions and certain percentage-based questions that you should have extremely strong memory. But our target is not those questions. Our target is to
Correct.
go combat the easy questions and medium questions. Because if you struggle in easy questions, you're gonna make sure not great in medium and hard questions. The make or break rank is always from the easy questions. That is what I
True.
understood.
True.
Always
So,
easy.
So, as Dr. Akhil pointed out, those who are preparing for the mid-year exam, I think so your strategy should be very simple. The videos which are there in Marrow are sufficient to cover your general surgery part. In addition to that, as Dr. Akhil has mentioned, to get that advantage over other students, focus on the tables of the new Sebastian and revise the tables of Bailey. Some of these tables we have made into pearls in the Marrow surgery app, so you can utilize them as well. Don't miss out on the Q bank and the grand test, because these are the real game changers which are there. And also the test and discussion videos which I have added, which are based on the new Sebastian updates. So these three things, these new videos, some students think that the videos are same as NEET PG. There are additional videos where I've covered the tests and discussions as well. Please go through them, because they have the updates which you need to know and to get that extra edge over other students. So thank you very much for your time, Dr. Akhil. It was great interacting with you, and we wish you
Yes,
all the
sir.
best for your career in future.
Thank you, sir.
Thank you. Thank you, Doctor.
Yeah, it was my honor to talk to you, sir. It has always been a dream to talk to you.
Thank you. Thank
Hopefully,
you.
one day in Delhi, I can come and meet you, sir.
Absolutely. Absolutely.
Sure, sir.
All right. Thank you very much.
Thank you, sir. Thank you, sir.